Overview of Canadian healthcare system. 1 federal, 3 territorial, and 10 provincial systems. 3 territories and 10 provinces. Major complexities in establishment of Canadian health policy include geographical diversity, socioeconomic divisions, and international pressures. Financed by both the public 70% and private sector, 30% private. Each provincial territorial plan must cover all medically necessary health services and remain in compliance with the Canada Health Act in order to receive federal transfers. Provincial territorial governments may choose to offer and fund supplementary services not covered under the Canada Health Act, such as prescription drugs and vision care. Non-insured health services and fees are either covered by private insurance or by the individual. Workers' compensation funds cover treatment for work-related injuries and disease. Okay. Now, attention, this is important, the principles of the Canada Health Act. There are 5 principles. 1. Public administration. 2. Comprehensiveness. It means it must cover all needed services and exams. 3. Universality. It means it should cover all eligible residents. 4. Portability. It means you can move to another province and you are still covered, and who will pay the bill will be your home province. And also accessibility. The plans must make sure that it's accessible and remove all barriers, especially financial barriers to health care. So let's read in details. 1. Public administration. Provincial territorial health insurance programs must be administered on a not-for-profit basis by public authorities. 2. Comprehensiveness. Provincial territorial health insurance programs must cover all medically necessary diagnostic, physician, and hospital services. 3. Universality. All eligible residents must be entitled to healthcare services, including status First Nations peoples and Inuit. Note that non-status First Nations and Métis are included under all eligible residents. Portability. It's number 4. Emergency health services must be available to Canadians who are outside their home province, paid for by the home province. And 5. Accessibility. Provincial territorial plans must ensure reasonable access to medically necessary hospitals and physician services without financial or other barriers. Table 1. Division of government responsibilities in healthcare. Federal versus provincial. The Constitution Act was responsible for this division. So, responsibilities of the federal government. Healthcare services for Indigenous peoples, status First Nations, peoples and Inuit only, non-insured health benefits, NIHB, federal government employees, RCMP and armed forces, immigrants and civil aviation personnel, marine hospitals and quarantine, Constitution Act 1867, investigations into public health, regulation of food and drugs, like FDA, in the US, inspection of medical devices, administration of healthcare insurance, general information services related to health conditions and practices. Role in health derives from constitutional responsibility over criminal law, spending powers, and legislation for peace, order, and good government. Examples include Canada Health Act, Food and Drugs Act, Controlled Substances Act, and Canada Health Transfer Act. Now, provincial government responsibilities. Establishment, maintenance, and management of hospitals, asylums, charities, and charitable institutions, Constitution Act 1867. Licensing of physicians, nurses, and other health professionals. Determining the standards for licensing all hospitals. Administering provincial medical insurance plans, financing healthcare facilities, delivery of certain public health services. Legal foundation. The legal foundation of the Canada Canadian health system is based on 5 constitutional documents and 2 statutes. The 5 constitutional documents are 1. Royal Proclamation of 1763, the foundation for the rights of Indigenous peoples in Canada, sets out the sovereignty of Indigenous peoples in Canada. 2. The Constitution Act 1867 deals primarily with the jurisdictional power between federal and provincial governments. 3. The Treaty 6 of 1876 included the Medicine Chest Clause, which addresses Indigenous sovereignty in healthcare delivery and equitable access to all forms of medicine. Court ruling Driver v. King, 1935, provided the legal precedents for non-insured health benefits. The Canadian Charter of Rights and Freedoms, 1982, this is number 5, does not guarantee a right to health care, but if the government decides to finance health care, they are constitutionally obliged to do so consistently with the rights and freedoms outlined in the Charter, including the right to equality, physicians' mobility rights, etc. The federal government can reduce its contributions to provinces that violate the key principles of the Canada Health Act. So the 2 statutes, 1. Canada Health Act 1984 outlines the national terms and conditions that provincial health systems must meet in order to receive federal transfer payments, those 5 principles that we just mentioned. 2. Canada Health and Social Transfer Act of 1996. Federal government gives provinces a single grant for health care, social programs, and post-secondary education. Division of resources at provinces' discretion. That's it. That was video 1. Next video will start from the history of the Canadian healthcare system.